Medicare stops at the U.S. border. Most Americans planning to retire abroad already know that. What many do not realize is that the decision they make about Medicare before they leave could cost them thousands of dollars every year for the rest of their lives. And once that mistake is made, you cannot undo it. Today, we are going to look at exactly what happens to Medicare when you move overseas, what coverage options exist, and the one decision you should make before you book your flight. Here is what many Americans planning to retire abroad assume. They assume they will stop using Medicare, stop paying for Medicare, and deal with it later if they ever return to the United States. It sounds logical, and for many retirees, it becomes one of the most expensive assumptions they make. The reason is simple. The real issue is not whether Medicare covers you overseas. It generally does not. The real issue is what happens if you decide to come back and discover that regaining coverage is more expensive than you expected. More than 600,000 Medicare-eligible Americans currently live outside the United States. Every one of them faced this same decision. Some made the right choice. Others have been paying the price every month since. Let us look at exactly what Medicare does and does not cover once you leave the country, because the exceptions are far more limited than most people realize. Here's the direct answer from Medicare.gov. In most situations, Medicare will not pay for healthcare or supplies you get outside the United States. There are three narrow exceptions: medical emergencies near the U.S. border, certain situations while traveling through Canada, and ships within 6 hours of a U.S. port. But for someone retiring to Portugal, Spain, Mexico, Costa Rica, or Panama, those exceptions rarely matter. For practical purposes, Medicare provides no routine healthcare coverage abroad. The question is not, will Medicare cover me overseas? The answer to that is usually no. The more important question is, what should I do with Medicare before I leave? Because the financial consequences of that decision can follow you for years after you move, and even after you come back. For most retirees, Part A is easy. Part A covers hospital care and is premium-free for most Americans who paid Medicare taxes for at least 10 years. Keep it. It costs nothing and provides hospital coverage if you return to the United States. Part B is where the real decision begins. Part B covers doctor visits, outpatient care, and medical equipment. The standard 2026 premium is $202.90 per month. If you move abroad, you will be paying $202.90 every month for coverage you generally cannot use. That is $2,434 per year. Over a 10-year retirement abroad, that is more than $24,000. So the choice appears obvious. Keep paying for coverage that does not work where you live. Or stop paying and use that money for your actual life overseas. Most retirees looking at those numbers lean toward dropping Part B. And that is exactly where the problem begins. Because the real question is not whether you should keep paying. The real question is, what happens if you stop? If you drop Part B and then try to re-enroll later, whether you return to the United States, change your mind, or need Medicare coverage again, you will pay a late enrollment penalty. That penalty is 10% of the standard Part B premium for each 12-month period you went without coverage. And here's the detail that most articles get wrong. The late enrollment penalty is not a one-time fee. It is added to your monthly Part B premium permanently for as long as you have Medicare, for the rest of your life. Let us put real numbers on that. Suppose you move overseas for 5 years and drop Part B. 5 years equals 5 separate 12-month periods. That creates a 50% late enrollment penalty. Using the 2026 standard premium of $202.90 per month, that penalty adds another $101.45 every month. Your new monthly premium becomes $304.35. Not for a year, not for 5 years, for the rest of your life. There is also a timing problem. If you drop Part B and want to re-enroll, you must wait for the general enrollment period, January 1st through March 31st each year. Coverage does not start until July 1st. If you return to the United States in April needing medical care, you have a 3-month gap with no coverage, and the permanent penalty is waiting for you when coverage finally begins. This is precisely why consulting a U.S. expat benefits specialist before making any Medicare enrollment decision is not optional advice. It is essential advice. If you are researching retirement abroad and want to avoid costly mistakes, subscribe to Next Chapter Abroad. Every episode is sourced directly from government agencies, immigration authorities, and official data, not internet rumors. New episodes every week. One option is international health insurance. Safety Wing is one of the most widely used providers among expats and is an affiliate partner. The link is in the description. It works best as catastrophic and emergency coverage. If you have ongoing medical conditions or significant prescription needs, you may need a more comprehensive policy. For local healthcare access, it depends on where you land. In Portugal, the SNS is available to D7 holders after establishing residency and registering at your local health center. In Spain, on the non-lucrative visa, private health insurance is not optional. It is mandatory for the visa and every renewal. It must come from a Spanish authorized insurer with no copayments and no waiting periods. In Mexico, Costa Rica, and Panama, public healthcare systems are accessible to legal residents after residency is established. The timeline and process varies by country and visa type. A third option is the hybrid approach. Keep Part B, while also carrying international insurance during the transition period. It costs more short-term, but eliminates the permanent penalty risk entirely while you establish local healthcare access. At this point, the question becomes simple. Who should keep Part B, and who might reasonably consider dropping it? If you're in good health, confident you will be abroad for 5 or more years, and have solid international coverage in place, the math on dropping Part B may work in your favor. But run the numbers on the permanent penalty first. If you are uncertain about your timeline, managing ongoing health conditions, or planning to return to the United States within a few years, keeping Part B eliminates the risk entirely. And if you are not sure which category you fall into, that is the most important signal of all. Default to keeping Part B until you have clarity. That is why we built a free Medicare Abroad decision checklist. It walks through the same questions covered in this episode so you can evaluate your own situation before making a final decision. The link is in the description. For many retirees, the Medicare question is not about healthcare coverage overseas. It is about whether the savings from dropping Part B outweigh the permanent costs and risks of getting that decision wrong. Before you drop Part B or make any Medicare decision for your move abroad, download the free Medicare Abroad decision checklist in the description. It walks you through the keep or drop framework, the permanent penalty calculation, and the healthcare coverage questions to answer for your specific destination. Free. Link below. Medicare stops at the U.S. border, but that does not mean your healthcare options stop there, and it does not mean the Medicare decision has to derail your plans. The key is simple. Understand what Medicare does not cover abroad. Understand the permanent cost of dropping Part B, and understand what healthcare system will replace it before you leave. Make the decision with a plan, not after the fact. This is Next Chapter Abroad, helping Americans navigate retirement and alternative lifestyles around the world. Your retirement. Your world. Every claim, every source, every time. We will see you next time.